Okay, let's start with the Oet speaking. And there are two cards you can see in your screen. One is role player card, and second card is candidate card. And in the exam, this is the 5 minutes speaking station. Total it is 8 minutes, out of which 3 minutes you will get to read the card, and 5 minutes you have to speak. And this all will be in your recording, and the role player is not the examiner. It's only to communicate with you, and the marks will be given all according as per your recording. So let's start, okay? And here you can see the two cards. Of course, the role player card will be given to the role player, and the candidate card will be given to you in the exam, in the speaking OET speaking exam. All right. So let's discuss first the cards and how you have to speak in the exam. And by speaking these lines, you can pass this exam easily. All right, here you can see the role player card. Of course, it will be the it will be the with it will be with role player, and you can see that setting is in role player card number one. You can see the setting is suburban clinic. Here is the carer, means the patient is not here in this setting. uh, Patient's father is sick, and here his son is there, his carer is there with you to discuss his scenario. So what exactly the scenario given to the role player, that your father, that's mean he's the son, Harry Smith, father name is Harry Smith, and is 68-year-old. He has a history of atrial fibrillation, abnormal heart rhythm, and takes warfarin anticoagulant to reduce the risk of thrombosis and embolism, abnormal formation and migration of the blood clots. You have come to see the doctor today to request a prescription of Panadine Fort for Harry, who 2 days ago fell at home and now has extensive bruising and pain on his right thigh but is otherwise well. What are the tasks given to the role player, that what he has to speak and what he has to tell to the doctor? Here it is given the task. Tell the doctor that yesterday your sister gave Harry a couple of her own Panadine 4 tablet which significantly relieved his pain. Today you have come to collect a prescription for Harry, who is in too much pain to walk to the clinic himself. And second task is become angry when the doctor refuses to give you a prescription, demand an explanation. And the third task is reluctantly agree to the doctor making a home visit for Harry, although you really think that this is unnecessary as the doctor knows Harry medical history. This is the role player card, okay? And what is your card? The candidate card. Of course, the both card will not be given to you. The only the candidate card will be with you, and you will be in the exam. This card will be given to you, and only you can read this card. All right, and here you can see the setting is suburban clinic. The doctor, you are speaking to the son and daughter of your 68-year-old patient, Harry Smith. Harry has a history of atrial fibrillation, abnormal heart rhythm, and takes warfarin anticoagulant to reduce the risk of thrombosis and embolism, abnormal formation and migration of the blood clots. The son and daughter is requesting a prescription of Manadin 4 for Harry, who 2 days ago fell at home and now has extensive bruising and pain on his right thigh but is otherwise well. What are the tasks given to you? Tell the son and daughter that you will not write a prescription for a patient without a consultation. So, this is the first task you have to fulfill, that you have to explain the patient that you cannot write the prescription without a consultation. All right, so just out of 8 minutes, 3 minutes will be given to you for reading the task, and you have to make the lines. You have to read your card, and you have to make the line that what are the appropriate line for not giving the prescription to the patient. This is the number one task you have to fulfill. Okay, so you have to remember in the mind. Even during this speaking time, also you can see the same card in that duration. but use that 3 minutes to make organize yourself and remember your task and what exactly the task is given to you, what exactly the setting is, and what exactly the task is given to you, and who to whom you are talking to. So there are three questions you have to ask before starting your consultation or before starting your communication speaking task. That the what exactly the setting is, where are you exactly now. So setting is suburban clinic, who you are the doctor, and to whom you are speaking not to the patient, you are speaking to the son and daughter of your 68-year-old known patient whose name is Harry Smith, and who have a history of atrial fibrillation, and he's on some anticoagulant medication. And because the son and daughter is requesting here for the prescription, and now you have to continue the task further on. The further on task is that you will not write a prescription of a patient, and you have to give the explanation for that one. Explain your decision standard of care, the importance of patient assessment and management decision, and warfarin contraindication, and express concern about the hairy well-being, and convince the son and daughter that a home visit with a hairy consent is most desirable in this situation. So what are the lines you have to give, and how will be the communication exactly? So let's start. Okay, let's solve this cards. Okay, so always remember that in OET speaking session you have to start the task. The candidate have to start the task first and introduce yourself, and then start greet the patient, and then you have to start. Here you can see that how the doctor's explaining and how the doctor introducing his or herself. So, good morning. I understand you have come in today to discuss your father, Harry Smith, um, condition, and I see he had a fall 2 days ago and is in significant pain. Please take your time and tell me exactly how he is doing at home. Okay, for directly jump into the that task, that no, I cannot write the prescription, sorry. You have to first greet the his son or daughter, and you have to ask that giving some lines that ask the current situation of the patient. So you can use this line, and role player can tell you that he is being in so much pain, and it's really hard to watch in this condition, and my sister gave him some of her own Panadol food yesterday, and it's finally gave him some relief, and I really need you to just give me a prescription today so we can keep him comfortable. Now you have to start your task, that I am certainly here how distressing this is for you, and I appreciate your desire to bring him some relief. It is very understandable that you want to do everything you can for him. However, regarding the request for Panadol Fort, I am afraid I cannot issue a prescription without conducting a formal clinical assessment of your father myself. Then role player will show some frustration, and he can speak like this, that honestly very frustrating. He's in too much pain to walk to the clinic, and you know his entire medical history. Why do you need to see him in person? Just give me the medicine, please. So then doctor should acknowledge this frustration, and speak like this, that I completely understand your frustration, and I apologize if this process feels difficult. Please know that my primary priority is your father's safety. As his doctor, it is a strict standard of care to perform a physical assessment before prescribing any new medication, especially when there has been an injury involved. To be specific, your father takes warfarin to manage his atrial fibrillation. Warfarin is a very delicate anticoagulant. Introducing a painkiller without a thorough review would lead to adverse interaction or complication that could affect his clotting level and his heart. I have to ensure that we are not masking a more serious injury from his fall. And the role player will again say like that, this that he's just bruised and in pain. That's all. I really don't see why a visit is needed when you already know all about his heart condition. Can't you make an exception just this once? And then doctor have to tell like this that I hear your concern. I truly want to ensure your father is as comfortable as possible. Because of the fall and the bruising, the most professional and the safest concern of action is for me to perform a home visit today. This will allow me to examine him thoroughly in his own environment and provide the correct safe treatment. With his consent, I can be there later today. This way we can address his pain without risking his safety. Does that sound like a plan we can move forward with? So here the 5 minutes will be finished, and you have already finished your all tasks. Like if we can see the task that tell the son and daughter that you will not write a prescription or patient for a patient without a consultation. This task you already explained, and you already explained the decision that why it is important, and why warfarin is contraindicated for this patient, like to give the painkiller, why it is contraindicated, and so you are explaining here, and in the end you are also explain your concern that you need a home visit for his father, and if his father is giving the consent, and already you explain in this line. So remember two key points with this video, that use phrase like for the signposting you can use this phrases like the reason I am concerned is, or you can use if I can explain the safety perspective, and always use acknowledge the emotions like this, that if the role player is showing very role player gets angry and start your next sentence, how you have to start your next sentence with an acknowledgement by using this, that I understand that sounds difficult, or you can use this, I recognize this is not what you wanted to hear, but this is very important. So here how you can finish this task. It's very easy to get the B and passing grade and A grade in the speaking session if you are practicing it regularly. Hope you this video and these sentences can help you. So wish you best of luck. Thank you. Bye bye.